Our emergency medicine program at the Medical College of Georgia at Augusta University is a fantastic program. We have multiple fellowships. We have a pediatric emergency department, adult emergency department, level 1 trauma, a comprehensive stroke center. We have great depth of resources that are available on campus, but all of those things really center around our residency programs.
I really love the team mentality of the residents here. We get along great and we work together very well. We're also very progressive in how we take care of patients.
You can see a variety of patients, from like the youngest, like newborn babies who are coming into the emergency department, also people who are 100 years old. And I tend to work better under pressure. Like I feel like, when there's a lot of things going on, I have more clarity. So I felt like it was more natural. It was a very natural environment for me to be in.
Pretty much whatever your interests are, MCG has a niche for that. You can get involved in as much or as little ultrasound, wilderness medicine, tactical medicine, international medicine as you want to. We really have an opportunity for everybody.
Our campus is really amazing. We have a world-class simulation center where our residents can go practice high-risk, low-volume procedures, and we've actually integrated simulation very heavily into our curriculum.
It adds a considerable amount of value to education. It really shows the residents what they do and don't know right there on the spot with a little bit of pressure on them. Instead of doing a simulation, having a big group watch, we break our resident group into pods, and that way everybody is involved in a simulation throughout the day.
We're also one of the leaders in the nation in emergency ultrasound and integrating ultrasound into our clinical care.
It's one of those things that's just a basic part of what we do. So ultrasound is used daily, nearly every patient. We have lots of them in the department as well as ones we can use for education and research. It's the new stethoscope. So if you come to our residency, this is just going to be part of your life.
And this year we're actually rolling out a mini fellowship. Essentially it will give the resident an opportunity to do a full ultrasound fellowship during their residency. They get a lot of hands-on, one-on-one education with our ultrasound credentialed faculty, and it's going to be really a fantastic add-on to what we already have.
Other things, we have an amazing anatomy department here. We actually do a fair amount of our procedural training actually on cadaver models. So when you have a high-risk procedure, our residents are actually able to do those procedures first on simulators, then on cadavers, anywhere before they would ever actually be touching a living patient. The community of Augusta still has a small town feel, and Augusta is a fantastic place to live. The cost of living is low. There are great opportunities for recreation and activities. Our residents often will own homes in the community because the cost of living here is so much less than many areas around the United States. Yet the clinical environment is really much more reflective of a large metropolitan university. When our residents graduate from our program, they are all outstanding emergency medicine physicians, and they are going to be able to provide clinical care in any environment that they're placed in.
When you're choosing your residency program, you want to make sure that you're going to come out of it feeling very comfortable and trained to go out in the world and manage patients on your own. And I think MCG for sure will give that to you.
If you want to be an emergency medicine physician that's prepared for anything that comes through the door and have a great time forming a good community in those 3 years, then MCG is the place to come.